the brain's reward system is already in a delicate spot, isn't it super risky to introduce a stimulant medication into the mix? This is the fear we have to address head on. So let's see what the evidence actually says.
Now, to get the clearest possible answer, we're not just looking at one or two studies. No, we're going straight to the top. We're looking at a massive systematic review that was done by VA Health Systems Research. What they did was gather up all the high quality evidence out there, put it all together, and analyze it to see what the big picture really looks like.
And here it is. This is the core finding, and honestly, it might surprise you. After looking at everything, the review concluded that prescribing stimulants to people with ADHD seems to have no effect on their risk of developing a new substance use disorder later on. Let me say that again. The fear that the treatment itself causes addiction, the evidence just doesn't back it up.
But like with most things in science, the story isn't quite that simple. While the evidence shows the medication doesn't seem to create new addictions, the review pointed to a different but really important risk, and that is the misuse of a legitimate prescription. So let's break down what that misuse can look like. This data shows that among people who do misuse their ADHD medication, about 31% used it with alcohol, 22% misused it in some other way, 16% actually skipped their meds so they could use other substances, and 10% used it specifically to get high. So you see the nuance here? The risk isn't that the treatment creates a new problem, it's that the medication itself can become part of the existing one if it's not used correctly. Okay, so let's zoom in a little bit now and talk about two of the most commonly used substances out there, alcohol and cannabis.